My name is Joe Rossano. I'm the Chief of Cardiology at the Children's Hospital of Philadelphia. I'm a pediatric cardiologist, and I'm going to talk to you today about a cardiomyopathy called Danon disease. Cardiomyopathies, which you may know, are heart muscle disorders, and Danon disease it can be a very severe form of cardiomyopathies, especially in boys and young men. It's a genetically mediated cardiomyopathy. It's carried on the X chromosome, so males just have one copy of it, and so if they have an abnormal copy, they can develop disease much earlier in life. There are some unique considerations and symptoms for patients with Danon disease that may differ from other forms of cardiomyopathies and other diseases that lead to heart failure. One is that it is a disease that affects not only the heart, but also the rest of the body. The protein that the gene encodes for is this protein that's called LAMP2, and that protein is seen all throughout the muscles, including the muscle in the heart, but also the muscles in the body. It's also expressed in the eye and in the brain. And people with Danon disease can have symptoms from those other organ systems that are affected. It was actually first described by a neurologist because of the involvement in other muscles in young children. It can affect the eyes, and the brain can also be affected, which can lead to some developmental delays and issues like that, although it can be a pretty wide a spectrum of disease. The symptoms can oftentimes be very subtle and mild, and at least initially may not necessarily be coming from the heart, but can involve some weakness, fatigue. There can be learning challenges, but because the symptoms are subtle and oftentimes not clear to people that there is a problem with the heart, it's not uncommon for patients to describe that they went to many specialists, and it took them many years before they received a diagnosis. The diagnosis can be made with near certainty with blood tests to look for these genetic abnormalities in the LAMP2 protein. And as boys and young men get older, the disease in their hearts can be pretty severe and can be pretty easy to diagnose with kind of routine cardiac testing like echocardiography. I did want to talk a little bit also about sort of disease progression and some of the treatment options. While I stated earlier that boys and young men are affected earlier in life, which is true. Women can also be affected. Women have two copies of the X chromosome, and so typically would have one normal copy of the gene and then one abnormal copy. And because of that, their disease may be quite variable. There are females that can present earlier in life and in childhood and be sick from their heart. But there are others that, may be, much older and still doing well from a heart standpoint. But in boys and young men, certainly by, adolescence and young adulthood, the vast majority of them will be affected from their heart. This genetic abnormality can lead to these hearts becoming very thick, and at the end of the disease can become massively thick. With this thickness, there's a lot of scarring that forms in the heart. There is a high risk for arrhythmias. These can be life-threatening. And there's also the development of heart failure, where the heart just can't function well enough to do the job of the heart, which is to get the blood out to the body effectively. Symptoms can become pretty severe, and with fatigue, difficulty, exercising and just performing, day-to-day activities can become very impaired. And sadly, without heart transplantation, most men will not survive beyond their early 20s. And while some therapies can be effective for this, like a defibrillator to treat lethal arrhythmias, the progression of heart failure, unfortunately, does not respond to our usual medications that we know that are effective for the treatment of heart failure. So there are many medications now which we give to people with heart failure, which improves how they feel, can improve how long they can survive. But sadly, in Danon disease, these medicines either are not effective at all or are much less effective. So we are really in a state of needing a much better therapy for this disorder. So the last thing I was going to talk to you about are what does the future look like? And I think some nice hope on the horizon for some potential new therapies that are being studied, which may prove to be very helpful for people with Danon disease. So we recently completed a phase 1 study, so a relatively early study on just a handful of people with Danon disease, but the study involved a gene therapy to replace this LAMP2 gene, which is deficient. There were 8 people treated, so not that many, and one of them ultimately needed to get a heart transplant. But the remainder of the patients are all alive with their own hearts. Some of them alive now, 5 years after receiving the therapy. And we learned a number of, I think, really important things from the study. One, the delivery system was effective. So we know we can get the gene into the heart. And for the vast majority of patients, we see that gene continues to be expressed even up to 5 years, after the therapy was initiated. There was also some early signals that it's helping the heart. So for the vast majority of patients, the thickness in their heart and some markers of injury either stayed the same or got better, which is very encouraging. And then outside of the one patient that had a heart transplant, and there were some unique aspects of that case, which I won't go into now, but outside of that patient, we did not see the disease progress, which we know happens in other people. So things either stayed the same or got better. Importantly, there can be serious side effects from gene therapy, which is an important part of the study and trying to look at ways to manage that and to mitigate those. But we were very encouraged by the early results, and so now are undergoing a phase 2 study of this gene therapy product, and again are very hopeful that we will see some nice results. And if this is effective, then we could make it available to people outside of the study, and hopefully to anybody with Danon disease, that was interested in the therapy. We're still, some time away from that. Probably at least a year away. It's hard to know for sure, but we're hopeful we can get this phase 2 study done, relatively quickly. And if the therapy does prove to be helpful, that we can get it to, as many people that are affected with this disorder.
This video is part of a series of educational videos developed by the Genetic Cardiomyopathy Awareness Consortium and brought to you by the DCM Foundation. Our goal is to connect you with the leading experts in the field of cardiomyopathy to further your understanding of this disease and to provide resources to help you manage your care. Thanks for watching.